Let me begin not by talking about my amendment, but by talking about Republican action right here on the floor of the Senate. Everybody in this country understands that our nation faces a significant number of major crises, whether it's the disintegration of our health care system, the fact that 17% of our people are unemployed or underemployed, 1 out of 4 of our children are living in food stamps. We've got 2 wars, we got global warming, we have a $12 trillion national debt, and the best the Republicans can do is try to bring the United States government to a halt by forcing a reading of a 700-page amendment. That is an outrage. People can have honest disagreements, but in this moment of crisis, it is wrong to bring the United States government to a halt. Now, Mr. President, I am very disturbed that I am unable to bring the amendment that I wanted to bring to the floor of the Senate dealing with a Medicare for All single-payer program. I want to thank Senator Reid for allowing me to try to bring this amendment to the floor before it was obstructed to and delayed and prevented by the Republican leadership. But I did want to mention that this legislation is co-sponsored by Senators Sherrod Brown and Roland Burris, and I was more than aware and very proud that this amendment would have been the first time in American history that a Medicare for All single-payer bill was brought before a floor of Congress. I was more than aware that that amendment would not win. I knew that. But I am absolutely convinced that this legislation or legislation like it will eventually become the law of the land. And the reason for my optimism that a Medicare for All single-payer bill will eventually prevail is that that will be and is the only mechanism we have to provide comprehensive, high-quality health care to all of our people in a cost-effective way, because it is the only approach which eliminates the hundreds of billions of dollars in waste, administrative costs, bureaucracy, and profiteering that is engendered by the private insurance companies, and that is the simple truth. We are not going to provide comprehensive, universal, cost-effective health care to all of our people without eliminating the hundreds of billions of dollars in bureaucratic waste and profiteering that currently takes place and is engendered by the private insurance companies. The day will come, although I recognize it is not today, when the United States Congress will have the courage to stand up to the private insurance companies and the drug companies and the medical equipment suppliers and all of those who profit and make billions of dollars every single year off of human sickness. And on that day, when it comes, and it will come, the United States Congress will finally proclaim that health care is a right of all people and not just a privilege. And that day will come as surely as I stand here today. Madam President, there are those who think that Medicare for All is some kind of a fringe idea. Just a few, left-wing folks out there think that this is the way to go. But let me assure you that this is absolutely not the case. The single-payer concept has widespread support all across this country. In a 2007 AP Yahoo poll, 65% of respondents said, and I quote, that the United States should adopt a universal health insurance program in which everyone is covered under a program like Medicare that is run by the government and financed by taxpayers. Madam President, there is also widespread support for Medicare for All approach among those people who understand this issue the most, and that is the medical community. And that support goes well beyond the 17,000 doctors in the Physicians for a National Health Care Program who are fighting every day for a single-payer system. It goes beyond the California Nurses Association, the largest nurses union in the country, who are also fighting for a single-payer system. Madam President, in March of 2008, a survey of 2,000 American doctors published in the Annals of Internal Medicine concluded that 59% of physicians, quote, supported legislation to establish national health insurance, end of quote. And, Madam President, you would be particularly interested to know that the New Hampshire Medical Society surveyed New Hampshire physicians and found, and I quote, two-thirds of New Hampshire physicians, including 81% of primary care clinicians, indicated that they would favor a simplified payer system in which public funds collected through taxes were used to pay directly for services to meet the basic health care needs of all citizens. End of quote. That's New Hampshire. In 2007, Minnesota Medicine magazine surveyed Minnesota physicians and found that, quote, 64% favored a single-payer system. 86% of physicians also agreed that it is the responsibility of society through the government to ensure that everyone has access to good medical care, end of quote. But it is not just doctors. It is not just nurses. It is not just millions of ordinary Americans. What we are seeing now is that national, state, and local organizations representing a wide variety of regions and interests support single-payer. These include the U.S. Conference of Mayors, the American Medical Students Association, the AFL-CIO, the National Association for the Advancement of Colored People, the National Association of Letter Carriers, the National Education Association, the United Church of Christ, the UAW, the International Association of Machinists, the United Steelworkers, the United Electrical Workers, and the Older American League, Older Women's League. There are so many other organizations that I will not take the time to list them, but I would ask, Madam President, unanimous consent that I can submit a list to the desk of all of the organizations representing millions and millions of Americans who are sick and tired of the current system and want to move toward a Medicare for all single-payer system.
Without objection.
Thank you. Madam President, there is also significant support in the House of Representatives for a single-payer system. Together, H.R. 676 and H.R. 1200, two different single-payer proposals, have 94 co-sponsors. And, Madam President, let me say a word about state legislatures that have moved forward aggressively toward a single-payer system. In California, our largest state, the state legislature there on two occasions passed a single-payer program. Largest state in America passed a single-payer program, and on both occasions it was vetoed by the governor. In New York State, the State Assembly passed a single-payer system. Among other states where single-payer has been proposed and seriously discussed are Ohio, Massachusetts, Georgia, Colorado, Maine, Vermont, Illinois, Wisconsin, Oregon, Washington, New Mexico, Minnesota, and Indiana, and New Hampshire. Madam President, why is it that we need an entirely new approach for health care in this country? Why is it? And the answer, I think, is pretty obvious. Our current system, dominated by profit-making insurance companies, simply does not work. Yes, we have to confess, it does work for the insurance company who make huge profits and provide their CEOs with extravagant compensation packages. Yes, it does work, and we saw how well it worked yesterday right here on the floor for the pharmaceutical industry, which year after year leads almost every other industry in profits while charging the American people by far, not even close, the highest prices in the world for prescription drugs. So it works for the insurance companies, it works for the drug companies, it works for the medical equipment suppliers, and many other people who are making billions of dollars off of our healthcare system, But, Madam President, it is not working. In fact, it is failing for ordinary Americans. Today, 46 million people in our country have no health insurance, and even more are underinsured with high deductibles or copayments. Today, as our primary health care system collapses, tens of millions of Americans do not have access to a doctor on a regular basis. And tragically, Madam President, some 45,000 of our fellow Americans who do not have access to a doctor on a regular basis die every single year. That is 15 times more Americans die of preventable diseases than were murdered in the horrific 9/11 attack against our country. And that takes place every year, 45,000 people. This is not acceptable. This is a manifestation of a collapsing system that needs fundamental change. Madam President, a number of months ago, I took to the floor to relay stories that I heard from people throughout the state of Vermont regarding the health care crisis, stories which I published into a small booklet and placed on my website. And let me just tell you one story. A man from Swanton, Vermont, in the northern part of our state, wrote to me to tell me the story of his younger brother, a Vietnam veteran, who died 3 weeks after being diagnosed with colon cancer. At the time he was diagnosed, he had been laid off from his job and could not afford COBRA coverage. In quote, this is what his brother said: when he was in enough pain to see a doctor, it was too late. He left a wife and 2 teenage sons in the prime of his life at 50 years old. The attending physician said that if he had only sought treatment earlier, he would still be alive. End of quote from his brother. Madam President, horrifically, tragically, that same story is being told in every state in this country over and over again. If only he had gone to the doctor in time, he could have lived, but he didn't have any health insurance. That should not be taking place in the United States of America in the year 2009. And the problem extends beyond even the thousands who die every single year needlessly. Many, many others suffer needless disability, strokes that leave them paralyzed because they couldn't afford treatment for their high blood pressure, or amputations, blindness, or kidney failure from undertreated diabetes. Infants are born disabled because their mothers couldn't get the kind of prenatal care that any mother should have. And millions with mental illness go untreated today. In a town in northern Vermont, not far from where I live, a physician told me that 1/3 of the patients that she treats are unable to pay for the prescription drugs that she prescribes. Think about the insanity of that. We ask doctors to diagnose our illness, to help us out. She writes a prescription drug. 1/3 of her patients cannot afford to fill that prescription. That is insane. That is a crumbling health care system. And the reason people can't afford to fill their prescription drugs is our people, because of pharmaceutical industry greed, are forced to pay by far the highest prices in the world for prescription drugs. This is indefensible. There's nobody who can come to the floor of this Senate and tell me that that makes one shred of sense. Madam President, the disintegration of our health care system causes not only unnecessary human pain, suffering, and death, but it is also an economic disaster. Talk to small businesses in Vermont, in New Hampshire, any place in this country, and they tell you that they cannot afford to invest in their companies and create new jobs because all of their profits are going to soaring health care costs, 10, 15, 20% a year. Talk to the recently bankrupt General Motors, and they will tell you that they spend more money per automobile on health care than they do on steel, and in the international competition that they are engaged in, they are forced to pay $1,500 per car on health care, while Mercedes in Germany spends $419 and Toyota in Japan spends $97. Try to compete against that. Further, from an individual economic perspective, it is literally beyond comprehension that of the nearly 1 million people who will file for bankruptcy this year, the vast majority of those people are filing for bankruptcy because of medically related illnesses. Further, from an emotional point of view, let's just take a deep breath and think about millions of people who are today struggling with cancer, struggling with heart disease, struggling with diabetes or other chronic illnesses. And you know what? They are not even able to focus on their disease, trying to get well. They're summoning half of their energy to fight with the insurance companies to make sure they get the coverage that they need. That is not civilized. That is not worthy of the United States of America. Madam President, in my state of Vermont, and I suspect it is quite similar in New Hampshire and every other state in this country, we have all walked into small mom-and-pop stores, and we have seen those little donation jars that says, help out this or that family, because the breadwinner in that family is struggling with cancer and does not have any health insurance, or little Sally needs some kind of operation and she doesn't have any health insurance. Put in $1 or $5 to help that family get the health care that they need. This is in the United States of America. This should not and cannot be allowed to continue. Madam President, one of the unfortunate things that has occurred during the entire health care debate that we are in right now is that we have largely ignored what is happening in terms of health care around the rest of the world. I have heard some of my Republican colleagues get up and say, we have the best health care system in the world. Yeah, we do if you're a millionaire or a billionaire, but not if you're in the middle class, not if you're a working class person, certainly not if you're low income. It's just not true. Today, the United States, despite 46 million being uninsured and more being underinsured, spends almost twice as much per person on health care as any other country. And despite that, our health care outcomes are in many respects, not all, but in many respects worse than other countries in terms of life expectancy. Other countries have longer life expectancy than we do. They're better in infant mortality, and they do a lot better job in terms of preventable deaths. It seems to me that at the very beginning of this debate, we should have asked a very, very simple question. And that is, why is it that we are spending almost twice as much per person on health care as any other country with outcomes that in many respects are not as good? Madam President, according to an OECD report in 2007, the United States, and this is what this chart is about, the United States spent $7,290, over $7,000 per person on health care. Canada spent $3,896, almost half of what we spent. France spent $3,601, less than half of what we spent. The United Kingdom spent less than $3,000, and Italy spent $2,600 compared to the more than $7,000 we spent. Now, don't you think that maybe the first question that we might have asked is, why is it that we spend so much and yet our health care outcomes in many respects are worse than other countries? Now, why is it that that happens? Well, let me tell you what other people are not going to tell you. And that is one of the key issues that needed to be debated in this health care discussion, which has not been discussed. And the reason, and the simple reason, as to why we spend so much more than any other country with outcomes that are not as good as many other countries, is that this legislation from the very beginning started with the assumption that we need to maintain the privacy of private, for-profit health insurance companies. And that reality, that basic reality, that we cannot touch private insurance companies. In fact, that we got to dump millions more people into private health insurance companies. That was an issue that could not be even discussed. Sadly, despite all the money that we spend, we get poor value for our investment. According to the World Health Organization, the United States ranks 37th in terms of health system performance. Compared with 5 other countries, Australia, Canada, Germany, New Zealand, United Kingdom, the U.S. healthcare system ranks last or next to last on the measures of quality, access, efficiency, equity, and healthy lives. And then they do things. Sometimes these groups poll people. They go all over the world and they poll people in a country and they say, well, how do you feel about your own healthcare system? And we end up way, way down below behind other countries. You know, recently, while the Canadian healthcare system was being attacked every single day, they did a poll in Canada. And they said to the Canadian people, you know, what do you think about your health care system? People in America say you got a terrible system. Do you want to junk your system and adopt the American system? By overwhelming numbers, overwhelming numbers. The people of Canada said, thank you, no thank you. We know the American system. We will stay with our system. I was in the United Kingdom a couple of months ago, and I had an interesting experience. It was a parliamentarian meeting, and I met with a number of people in the Conservative Party, not the Labour Party, not the Liberal Democratic Party, the Conservative Party, the party which likely will become the government of that country. And the Conservatives were outraged by the kind of attacks being leveled against the national health system in their country, the lies that we're being told about their system. And in fact, the leader of the Conservative Party got up to defend the national health system in the United Kingdom and said, if we come to power, we will defend the national health system. Those are the Conservatives. Madam President, what is the problem with our system which makes it radically different than the system in any other industrialized country? And it is that we have allowed for-profit private corporations to develop and run our healthcare system, and the system that these companies have developed is the most costly, wasteful, complicated, and bureaucratic in the entire world. Everybody knows that. With 1,300 private insurance companies and thousands of different health benefit programs, all designed to maximize profits, private health insurance companies spend an incredible 30% of every health care dollar on administration and billing, on exorbitant CEO compensation packages, on advertising, lobbying, and campaign contributions. This amounts to some $350 billion every single year that is not spent on health care, but is spent on wasteful bureaucracy. It is spent on bureaucrats in an insurance company telling us why we can't get the insurance we paid for. And how many people today are on the phone arguing with insurance companies about trying to get the benefits that they paid for? It is spent on staff in a physician's office who spend all of their time submitting claims. They're not treating people, they're submitting claims. It is spent on hundreds of people working in the basement of hospitals who are not delivering babies, they're not treating people with cancer, they're not making people well, they are sending out bills. That's what we do. We send out bills. And we spend hundreds of billions of dollars doing that rather than bringing primary health care physicians into rural areas, rather than getting the dentists that we need, rather than getting the nurses that we need. Madam President, let me just give you a few outrageous examples. Everyone knows that this country is in the midst of a major crisis in primary health care. We lack doctors, we lack nurses, we lack dentists. A major, major crisis getting worse every single day. Yet, while we are unable to produce those desperately needed doctors and nurses and dentists, we are producing legions of insurance company bureaucrats. And here is a chart which deals with that issue. What this chart shows is that over the last 3 decades, the number of administrative personnel, bureaucrats who do nothing to cure our illnesses or keep us well, the number of bureaucrats has grown by 25 times the number of physicians. This is insurance growth, non-existent. This is healthcare bureaucrats on the phone today telling you why you can't get the healthcare coverage you paid for, or telling you that you have a pre-existing condition, or throwing you off of healthcare because you committed the crime last year of getting sick. This is where our healthcare dollars are going, and that is why we need a single-payer system. According to Dr. Huey Reinhardt, let me give you another example. In testimony before Congress, Duke University Hospital, a very fine hospital, has almost 900 billing clerks to deal with hundreds of distinct managed care contracts. Do you know how many beds they have in the hospital? They got 900 beds. And they got 900 bureaucrats involved in billing for the 900 beds. Tell me that that makes sense. Madam President, at a time when the middle class is collapsing and when millions of Americans are unable to afford health insurance, health premiums are soaring, as are the profits of health insurance companies. From 2003 to 2007, the combined profits of the nation's major health insurance companies increased by 170%. And while more and more Americans are losing their jobs, the top executives in the industry are receiving lavish compensation packages. In 2007, despite plans to cut 3 to 4% of their workforce, Johnson & Johnson found the cash to pay its CEO, Bill Weldon, $31.4 million. Ron Williams of Aetna took home $38 million. And the head of Cigna, Edward Hanway, took away $120 million over 5 years. And on and on and on it goes. Madam President, let me briefly describe the main features of a Medicare for All single-payer system. And let me briefly describe what's in the bill. In terms of access, people getting into health care, this legislation would provide for all necessary medical care without cost sharing or other barriers to treatment. Every American, not 94%, 100% of American citizens would be entitled to care. In terms of choice, the issue is not choice of insurance companies that our Republicans are talking about, Republican friends talk about. The question of choice is choice of doctors, choice of hospitals, choice of therapeutic treatments. And under our single-payer legislation, this would provide full choice of physicians and other licensed providers and hospitals. Importantly, and I know there is some confusion here, a single-payer program is a national health insurance program which utilizes nonprofit private delivery system. It is not a government-run health care system. It is a government-run insurance program. In other words, people would still be going to the same doctors, still going to the same hospitals and other medical providers. The only difference is that instead of thousands of separately administered programs run at outrageous waste, there would be one health insurance program in America for members of Congress, for the poorest people in our country, for all of us. And in that process, we save hundreds of billions of dollars in bureaucratic waste. In terms of benefits, what are you going to get? A single-payer program covers all medically necessary care, including primary care, emergency care, hospital services, mental health services, prescriptions, eye care, dental care, rehabilitation services, nursing home care as well. In terms of medical decisions, those decisions under a single-payer program are made by the doctors and the patients and not by bureaucrats in insurance companies. Madam President, if we move toward a single-payer program, we can save $350 billion a year due to administrative simplification, bulk purchasing, improved access with greater use of preventative services, and earlier diagnosis of illness. People will be able to get to the doctor when they need, rather than wait until they're really sick and end up in a hospital. Further and importantly, like other countries with a national health care program, we would be able to negotiate drug prices with the pharmaceutical industry and end the absurdity of Americans being forced to pay 2, 3, 5 times more for certain drugs than people around the rest of the world. Madam President, every other industrialized country on earth primarily funds health care from broad-based taxes in the same way that we fund the Defense Department, Social Security, and other agencies of government. And that is how we would fund a national health care program, not the insane way of millions of different kinds of funding sources, which creates a complicated system and enormous waste. And let me be specific. What this legislation would do is, number one, eliminate all payments to private insurance companies, so people will not be paying premiums to United Health, WellPoint, Blue Cross Blue Shield, and other private insurance companies. Not one penny. The reason for that is that private, for-profit health insurance companies in this country would no longer exist. Instead, this legislation would maintain all of the tax revenue that currently flows into such public health programs as Medicare, Medicaid, and CHIP, and it would add to that an income tax increase of 2.2% and a payroll tax of 8.7%. This payroll tax would replace all other employer expenses for employee health care. In other words, Madam President, employers in this country, from General Motors to a mom-and-pop store in rural America, would no longer be paying one penny toward private insurance revenue. The income tax would take the place of all current insurance premiums, co-pays, deductibles, and all other out-of-pocket payments made by individuals. For the vast majority of people, a 2.2% income tax is way less than what they now pay for all of those other things. In other words, yes, you would be paying more in taxes. That's true. But you would no longer have to pay for private health care, private health insurance, and at the end of the day, from both a financial perspective and from a health security perspective, we would be better off as individuals and as a nation. What remains in existence, I should add here, is the Veterans Administration. I believe, most of us believe, they have a separate set of issues. The VA remains as it is. Madam President, let me bring my remarks to a close by giving you an example of where I think we should be going as a country in terms of health care. And oddly enough, the process that I think we should be using is what a small country of 23 million people, the country of Taiwan, did in 1995. 1995, Taiwan was where we are right now. Massive dissatisfaction with a dysfunctional healthcare system. And they did what we didn't do. They said, let's put together the best commission we can, the smartest people that we know. Let's go all over the world. Let's take the best ideas from countries all over the world. As Dr. Michael Chen, Vice President, CFO of Taiwan's National Health Insurance Bureau, explained in an interview earlier this year, the Taiwanese ultimately chose to model their system after a worldwide search after our Medicare program. That's where they went, except that they chose to insure the entire population rather than just the elderly. After searching the globe, the Taiwanese realized what many Americans already know. A Medicare for all, single-payer system is the most effective way to offer quality coverage at a reasonable price. Taiwan now offers comprehensive health care to all of their people, and they are spending 6% of their GDP to do that, while we spend 16% of our GDP. But unfortunately, the single-payer model was not really ever put on the table here. Maybe we should learn something from our friends in Taiwan. Let me just end by saying this. This country is in the midst of a horrendous health care crisis. We all know that. Now, we can tinker with the system. We can come up with a 2,000-page bill which does this, that, and the other thing. But at the end of the day, if we are going to do what virtually every other country on earth does, provide comprehensive, universal health care in a cost-effective way, one that does not bankrupt our government or bankrupt individuals. If we're going to do that, you're going to have to take on the private insurance companies and tell them very clearly they are no longer needed. Thanks for your service. We don't need you anymore. A Medicare for All program is the way to go. And I know it's not going to pass today. I know we don't have the votes. I know the insurance company and the drug lobbyists will fight us to the death. But mark my words, Madam President, the day will come when this country will do the right thing, and on that day, we will pass a Medicare for all single-payer system. Madam President, let me now move to table Senator Hutchinson's amendment and ask for the yeas and nays.
Is there a sufficient second? There appears to be. The clerk will call the roll.
Mr. Akaka, Mr. Alexander.